This is the final report of findings on Dr. Huffaker's case number 627. The periapical shows tooth number 30 with periapical radiolucencies around both the mesial and distal root and what looks like a porcelain fused to metal full coverage crown. There is an opposing dentition. His TDO-MTI form reveals no abnormal testing results, with the chief complaint being the presence of a draining sinus tract. The diagnosis is necrotic pulp with chronic apical osteitis or periodontitis. The perioprobings are listed as within normal limits. The TDO diagnosis form makes note of both mesial and distal radiolucencies and a buccal sinus tract, as well as evidence of some furcal breakdown. The treatment form indicates the pulp was found to be necrotic in all canals upon entry and instrumented out to a 20V taper to the terminus in all three canals. A gentle wave procedure was done. The canals obturated with gutta percha and AH plus sealer and dual cure composite placed as the coronal endodontics. The case was treated and restored in a single visit on April 12, 2022. The immediate post-op radiograph reveals an obturation to the terminus in both roots with a slight sealer extension on the mesial root. The TDO case summary form is shown, reviewing the details on page 1. Dr. Huffaker's notes reveals that in July of 2023, the patient returned for a recall and the tooth was asymptomatic, but a drainous sinus tract was seen. A cone beam was taken and there was suggestion that the lucency on the distal root had enlarged considerably. Options were discussed and the patient decided to have the tooth extracted. It was extracted and sent to me for analysis. The tooth was received intact in formalin. Upon inspection, there were no evident root fractures seen and no periapical tissues were attached. I took a series of angled radiographs again with no evident fractures detected. Following our protocol, the crown was sectioned off, the mesial and distal roots separated, and each root split sagittally. The mesial root was split into two halves with the gutta percha staying intact in one of the halves. The mesial sagittal split was not ideal at the terminus, and only one half contained the canals to the terminus. The distal canal was similar in that one half contained the gutta percha intact for the entire length, but only one side had intact canal all the way to the terminus. After dehydration and ascending alcohol rinses, as per our protocol, the remaining gutta percha was teased out of both mesial and distal canals, and the section sputter-coated with 20 nanometers of gold palladium. This is the mesial canal sputter-coated sample with the removed GP. This is the alternate side where you can see clearly the instrumentation paths. Teasing the GP out of the distal canal was more difficult, but we were eventually able to remove it and gain access to some areas where the naked canal wall was evident. In other areas, the AH plus sealer completely covered the canal wall. These are sputter-coated views of the distal root to help you with your specimen orientation. We will look at several areas. This is area 1 on the mesial root near the terminus. When we go into the root, we can see the mineralized part of the predentin in various stages of being demineralized, but in some areas, we get a suggestion of the bacterial morphotypes like this that seem embedded into the predentin. In area 2, more coronal, we get a better look at the naked canal wall without a lot of sealer present. And what we notice is that the peritubular dentin is still present and hasn't been demineralized by the irrigation device. Notice how the non-collagenous proteins of the predentin can masquerade as bacterial biofilm morphotypes. In area 9 of the mesial root, where the canals meet, we again get a very good look at the naked canal wall in the mineralization front, where there is minimal predentin present, but where the peritubular dentin has not been demineralized. So it looks like all the predentin has been removed, but there has been minimal demineralization of the peritubular dentin and minimal demineralization at the mineralization front. In the distal root at mid-root area 3, again, we see almost no predentin and minimal demineralization at the mineralization front. And most of the dentinal tubules are occluded with the non-collagenous proteins, which have not been demineralized. Here you can see how those non-collagenous proteins masquerade as biofilm morphotypes. At the terminus of the distal root in the area labeled number 4, a closer examination of this area suggests true bacterial morphotypes, along with the sealer, instrumentation debris, and some predentin debris. Here you can see the demineralization of the collagen substructure, as well as what I am suggesting are bacterial morphotypes. In area 10, in the same general area, as we zoom in, you see part of the mineralized predentin structures, but also the suggestion of bacterial morphotypes. Images like this just point out how difficult it is to make these determinations and how one must lower their confidence when making such inferences. I hope these examinations help you, and I am open to discussions if desired.